Michale Chatham, and I'm the RN BSN myofunctional therapist and licensed massage therapist here at Smile Ranch Dentistry. I'm one of the people that you'll meet if you come in to have your infant evaluated for a tongue tie. This video is going to include some of the rationale, some of the reasons that we require bodywork be done in conjunction with a tongue tie release. Many times we find that even having bodywork done prior to release is imperative to get a good outcome for release. So what I'm going to use are some props to kind of give you a visual on how your baby is connected and wired up. So especially here at Smile Ranch, we absolutely operate off of the concept that the body is whole. It's all connected, everything works together, and that's what makes us functional and healthy and whole. So I'm going to use some props here. I'm going to use some bears, I'm going to use some photos, and I'm going to talk about the tongue and its movement. And as you know, in ankyloglossia or tongue tie, that is a restriction of tongue movement. We also have lip tie. Babies can be tied in other places too. There are 7 oral frena. There are 3 on the top lip, 3 on the bottom lip, and 1 under the tongue. And so at Smile Ranch, we're going to evaluate all 7 attachments to the mouth. So even though there are 7 naturally occurring attachments, we're going to try to differentiate during the exam which attachments are restricted or not and how they impact the overall function of your infant's mouth and breastfeeding. We want to look at latch, we want to look at the hips, we want to look at how the neck and the head move. All of those things matter when it comes to releasing a tongue tie. So if you can just imagine for a moment that the tongue is a bone-free organ in the mouth. It's responsible for posture. It's a postural muscle. It is kind of the floor jack to the cranium, if you will. So it's used to stabilize the head to the rest of the body muscularly and leave the jaw free to move. In the tongue-tied infant, they don't have that capability because they can't get the tongue all the way to the palate. And also imagine for a moment that the tongue is the flicker on a flame or a flame to a candle. And this candle's pyramid shaped. And so the top of the pyramid is here, the foundation of the pyramid is here. And so all of the muscles of the tongue are attached to each other, and those muscles are rooted in the neck, the throat, and the back of the head. So that gives the tongue stability. The frenum gives it mobility. A tongue tie prevents mobility. And so what we're trying to do is stabilize the body, allow the tongue to move so that the tongue can be agile and move side to side in all the directions that it needs to. So when a baby is born, there's all types of head postures that might be involved. The baby's pulled into the midline and down toward his belly, and then during the birthing process is supposed to open up and arch and open up the chest and lift the neck and open up this throat area so that he can begin to move the tongue. And in the tongue-tied baby, what we find is that's not happening. So the benefit of tongue-tie release actually begins this process of opening up these areas. And that's what we want to encourage when we do a tongue-tie release, but we also want to address the body. So I have 2 bears, and these are my fascia bears. And so the frenum in the tongue or the lip is part of connective tissue. It's attached and part of the fascial system. The fascial system is kind of like blown-in insulation inside of a wall. So it gives us structure and form. It also is part of the nervous system. And so when we go in and do a frenectomy, we're actually removing part of this fascial system. And since it's all attached and it's all connected throughout the body, we are actually impacting the rest of the system. So what we have here is basically a dissected tongue. And this image is from Tom Myers' Anatomy Train's book. And at the top, we have the actual tongue. And underneath here, on this side, is the frenum, which we're actually evaluating. And that's what would be released if your baby needed a frenectomy. But the importance of this photo is that you can see that there's so many structures down the chain that are attached to the tongue. And this is really important because on the back side of this tongue, on the inside of the mouth, down the throat, That's where clicking comes from, and some mixing of air and breast milk and some other swallowing issues. And so you can see how easily in the tongue-tied baby that the frenum may not be the only problem. It's attached to the pharynx or the voice box across the neck. It's attached to the diaphragm here, and then down further into the pubic bone between the legs, and then the knee and the toes. So attached to all of this structure are other structures as well that can be involved and counted as part of the fascial system as well. So whenever your baby has some hip restrictions just from having been in utero, if your baby was breech positioned, that could be something that needs to be released, that if it were tight or tipped forward would cause the tongue to pull down into the body. So the tongue is trying to go up, it's trying to be the postural muscle that it's created to be, to breathe and swallow, but if there are pulls down on it, it's not going to move like it should. Now this photo doesn't even count for all of the fascial connections up into the temporomandibular joint, the TMJ, up into the soft palate, up around the head, and even into the front of the face this way. So this is a very important concept to understand when you start talking about the interconnectedness of the tongue to the rest of the body. Anytime you've got a baby that's been born and has been through the birth process in one form or another, you're going to have some remnants of in utero restriction present. That alone is justification for body work for any baby at birth. The orally dysfunctional infant makes that even more important. So when you've got a baby that is having oral dysfunction, you've always got some type of asymmetry going on. So in other words, down the midline, side to side, you've got differences in tension or relaxation that impact movement. So frenectomy becomes a hack to movement, and we really do need to focus on the whole movement of the body, not just the movement of the tongue, but how the whole body moves together so that the baby can get to the breast, wrap around the mom, get the head in the right position to optimize that jaw movement back and forth to extract the most milk in a pain-free, high volume, low suction way that's comfortable for both the baby and the mom. So in a baby that's got asymmetries and tightness along one side, a lot of times we'll see presentations that are torticollis or seem like torticollis but may not be. We've also got hip restrictions or compressions into the hips, or even where the pelvis is tucked forward and the chin wants to be brought down, and it's hard for the baby to get into extension. So this bear has restrictions. It may be the tongue, it may not be the tongue, but it's in the body, and this baby is going to have a side preference or a position preference because it's harder to get into position to move the jaw, to breathe, and to have a relaxed nervous system state at the breast. So what we're going for with tongue tie release is this agile, symmetrical, mobile, agile baby who can nurse in both positions or the position of his choice comfortably while he breathes well and feels well. So I hope this was a good explanation for why bodywork is so important, why we recommend it at Smile Ranch, why it's part of our assessment, and why it's so important to communicate to our bodywork practitioners about what your goals are as a mom, the problems that you're having, and how to bring the whole picture together so that we can have maximum optimal function for your infant. Thank you.